Good morning and welcome to our Work in Progress. This is a series of programs dedicated to the work of the Aspen Valley Foundation. And today we're very fortunate to have the director of the Aspen Homeless Shelter, Vince Savage, who is here to discuss with us the work of the shelter and something very exciting coming up in September, which is a major benefit for the homeless shelter. So Vince, welcome.
Thank you.
Good to see you. Not that I haven't seen you
I think
yesterday.
I've seen you recently, yeah.
Yeah, at our staff meeting yesterday. So Vince, you have been in town since, wow, the 80s?
Oh, the mid-'80s I
Yeah.
came here to run a alcohol and drug treatment program we called ARU that was owned
Right.
by St. Luke's Hospital.
And you stayed
Yeah,
and have a home in Marble, actually a lodge.
yeah. I own that retreat training center in Marble, but I also have a home in Aspen. So.
Uh-huh. And you've been with the homeless shelter now for 2 years, you were saying?
Yeah, I've been
August?
directing it for 2
Yeah.
years. Prior to that, we were next door with VIA, Valley Information and Assistance, so we had a lot of interaction with their clientele, but now it's become my clientele. So.
Yeah. Talk a little bit about VIA. The foundation started that many years ago, really to help people connect to local services. Isn't that right? And
Basically, yes. The Valley Information and Assistance is a pretty generic name. In fact, we laugh because at times we've gotten calls wanting to know about tea times at the Roaring Fork Club or something. I said, no, not that kind of information.
Yeah.
But nevertheless, yeah, that's our basic mission there, is to try to help people connect to local services, especially those people that we described some years back in a study as those falling through the cracks. Meaning we've got a lot of agencies in the valley, but there seemed to be a certain population that for a number of reasons didn't really get to utilize those services.
And we also describe them, I think, as chronically difficult to serve. I think
That's-
we got into really more emboldening VIA after a fellow was evicted from his apartment, remember, at
Yes.
the Country Inn, I think.
Yeah.
He hanged himself and then burned the unit. And for many, many meetings, people were wondering how we could prevent that sort of thing from happening
Exactly.
again. And even though he was in touch with different agencies, no one knew about the eviction and didn't know how he was suffering, and obviously didn't save him. And so that's when VIA kind of stepped up, and you stepped up. You did
Yeah.
a study too, I think, didn't you,
Yeah.
to really describe that population?
Yeah, and what we really looked at that via function is, it was like kind of like the mortar between the bricks. It doesn't matter how many great bricks you've got if they're just blowing in the wind and not held together, and that's kind of what happened in that case. He had talked to several people, but there was no point person, no what we have now, which is called the Pitkin County Case Management Team, which meets every other week or every second and fourth Wednesday. Yeah. But anyway, that sort of thing, just really, it's a matter of communicating
Yeah.
links, and helping make sure that somebody's the point person on a person who's in trouble.
Because I know in those meetings you discuss cases
Yeah.
with confidentiality usually, but the idea is so that everyone sort of knows if someone has been served, let's say, at the homeless shelter, and then they sort of disappear. Others say, well, he did show up at the community church the other day.
Yeah.
So that really makes a difference, don't you think,
Well,
in
yes.
terms of really making sure people are not sort
It's
of
better for the
lost.
client, and it's
Yeah.
better for the agencies, because each agency isn't starting from ground zero, or whatever
Right.
the right word was, step one, with a client that's already been in the hallways or somewhere else in the building or in the agency, portfolio of agencies in the county for weeks, and they're not starting. It also prevents clients from sort of doing what we call the revolving door thing. If they don't hear what they want to hear from one agency,
They go
to
someplace
a
else.
next one and
Yeah.
start this same story slightly altered. But this way we can coordinate, and it works better for the clients, really, and definitely better for the agencies.
And it
involved.
makes our resources more effective because we're
Well,
not,
right.
we're not spending
It
money
really
with
helps avoid duplication
You
of
bet.
services, which is one of the things I know the city brought up in their
Right.
discussions about funding health and human services is how do we know that with all these great agencies there's not duplication of services?
Well,
So
because
that
everybody's talking together, that's
that
why.
case management
Yeah.
team is at least one thing that
Right.
helps us answer that question is that yes, we know there's not as much as there could be.
Right. Before we get into more details about the shelter, just one other thing about VIA before we launch into the discussion about homelessness. But I think VIA sort of also took on another role after Katrina. And remember that meeting, I'm not even sure you were there. There was a big meeting in the city hall. Nan Sundin was facilitating it. And everybody was talking about how we could help as a community, how we could help the
Oh, and we
Katrina
raised
survivors.
$60,000 at the Belly Up.
It was like 160.
Maybe,
that
okay, it was a lot of
that
money.
was raised.
That
Yes,
was raised,
and
yeah.
then we offered to use our number, which was 544-5545, which is
Correct.
the same number still with VIA. And then you went into the business of resettling Katrina evacuees.
And that
which
still
really,
echoes today because
Yeah.
this person is not a Katrina evacuee, but we still have a strong connection to New Orleans in that area.
Right.
And so one of the people we have who's a fabulous, fabulous volunteer for the shelter, cooks sometimes 3 meals a week.
Cajun style.
Cajun style food, and our guys are getting heavy. We got the best fed group of homeless people anywhere.
Which is but again, I think the meal program is so important. So
Yeah.
we'll get into that. But obviously, VIA has been a very sort of low key element in the community, and now really merging because you're really running both
That's
functions.
correct, yeah.
I think that again is a way that we have merged functions and really become much more efficient and effective. So.
Absolutely, yeah.
So let's talk about the shelter. Obviously, people always think that the homeless shelter is only at St. Mary's Church,
Right.
but that's only in the winter. Why don't you describe what goes on during the day and the evening at the shelter now, and because
Yeah.
you're staffing it now and really have, if I may say so, professionalized the services for these people. I mean, I think that's what's really making a big difference.
That's been our goal, is to professionalize in the sense of having programmatic input and skilled people working with us who are not just, people who are watching the clock or, checking the door when people go in and out. It's a much more of a counseling-based thing, although we do not claim to be licensed as a counseling operation. Right. We have the people on board, many of which have those same credentials. So we've always said that we have basically these 3 programs. There's the one everybody knows about, which is the overnight shelter on the ground floor of the church.
And that's December 1st through...
Yeah, just in the cold months. Well, we're never sure if we're going to start a few
Yeah.
days early or go a few days late if there's a huge snowstorm. But basically,
usually around April it ends.
Yeah, the 1st of April, 1st of December through the 1st of April. And the purpose behind that is obvious. I mean, the coldest months of the year, we're trying to keep people from freezing to death, which has happened in this valley.
Right.
The second program is the day center. The second thrust of our whole operation is the day center, which gives people access to phones and computer and some counseling and some volunteer help on resume putting together, as well as laundry, shower, and other, things that are pretty critical to them trying to not become, horrifically homeless, totally sunburned and unshaven and poor hygiene. Because our goal with those that are capable is to try to get people back in the mainstream, and we've had some real success there. But the third part of the program is what we call the evening meal program, which is partly funded federally, but mostly not. And the idea there was to give these guys and gals something to focus on in the evenings, rather than being downtown in the way, at the fire pit, at every art opening and so on, wherever they could use the resources they could find. And in other words, we're trying to provide the resources that provide a good alternative to them just willy-nilly, trying to sponge off the downtown area. So we have had a lot of positive feedback about that program from the library, from the police, from downtown merchants. And people do ask us a lot of interesting questions, though, about our population. Like, we have homeless in Aspen? Where do they come from? And I'm always quick to tell people that our statistics show that at least half, maybe a little more, are people who grew up here or have worked here for decades. they have a tie to this community. They didn't just come off of Interstate 70
Right.
looking for a handout. We get a few that do come from out of town looking for jobs because they've heard it's a resort community and it's prosperous and that there should be ways to get work here, and some do. But we do have, a large, segment of our population that are from right here. So that's one thing to know. But
And usually there are, in terms of the profile of this population, there are usually a number of issues that they're dealing with. It's not just homelessness, but
well, the thing that one needs to understand about homelessness is there are various causes. For one, even in the best of economic times, there have been people that for either what I call attitudinal impairment or just sense of values, they don't want to live inside.
yeah.
They don't want to pay rent. Even if they're working, some people will camp out or sleep somewhere that doesn't cost them rent. Uh, it's just, and especially in our community where rents are not cheap, even in quote affordable housing, I can understand why some people make that choice. We have people that have recently lost their jobs and are totally new to the concept of being
Yeah.
homeless.
Especially in this economy, it's
Right,
been
right.
really, people have been in shock.
And then there's a small segment of people who have maybe alcohol and drug issues that are getting in the way of their prosperity, let's say, and a few people who have some mental health issues that are getting in the way of their adapting to the mainstream. And some of those we can't do too much about, excuse me, except just mollify their impact and mollify the impact of the situation on them. So, and it's an interesting issue that comes up occasionally because we get people that are able-bodied and looking for work, but they'll look across the room and say, well, what about that person sitting over there? How come you're not helping them or pushing them to work? I said, well, we did that the first year. And it became apparent that if we can just keep them safe, warm, and fed and look for opportunities. As you know, we have sent people to bigger communities where there are more resources. Some of our poster children in our homeless experience here, have been placed in places, not because we're trying to get rid of them, but because we're trying to help them, and the resources aren't just here. Because people forget that Aspen is still basically a rural economy. There aren't as many services or the variety of services that a place like Denver or bigger cities have. They can provide the population that is grist for the mill to have a specialized treatment center or a specialized care center, which we just don't have yet.
Maybe
we
we
may
will
do,
someday. Yeah. Speaking of the poster children, Michael and Jane, we actually sent a fundraising letter out a few months ago describing your success really with working with them, and it was we were under quite a bit of attack because people thought, what are you doing with these people who
You're enabling
had wrecked
them.
their van
Yeah.
and all this, and then you bought them another van for like $500, and ultimately they never used it much, but in the end, but you just continued to work with them. I think one of the things you are is persistent and
Yeah.
also non-judgmental, and that's quite a combo. But I think it seems to me that after knowing you and observing your work all these years, I think you're able to meet people where they're at and then help them work through some of the issues and sort of bring them up and on their way, if you will. And I think with them, I think you were able to do it in spite of the fact we got a lot of criticism about
Sometimes
doing
the
that.
first step is figuring out where they are at, as we say,
Yeah.
and then you meet them where they're at.
Right.
And yeah, I mean, I did things like ride around in their van with them, as they were sipping a tall boy or something, and people would criticize that, especially people in the field that I had been in for years, which is alcohol and drug treatment, which often comes heavily from the perspective of total abstinence is the only way to make progress. There are other theories, harm reduction theories and so on. In fact, it looks like we're getting a grant from a group called the ARP Incorporated, not the American Retirement,
Right.
whatever, but it's
only
called
one A.
Addiction Recovery
Yeah.
Unit, Addiction Recovery Programs in Colorado Springs.
Great.
And Canyon City is going to give us some money to help do just that, address better the addiction issues among our homeless population. Because if you're facing going outside to your sleeping bag somewhere at night in the middle of the winter, there's an incentive to think that if I had a few drinks, I might sleep better. So we're working at the whole idea of harm reduction and some kind of step system where people will get more benefits if they can at least address that.
And I think in a lot of cases with the people that you've been working with, especially Jane and Michael, you were able to connect Jane with family members in Boulder, and they sort of took on that responsibility of sort of letting them move on to Denver where there were resources. And I think Jane was in some kind of a apartment, and Michael in some nursing home or something.
Yeah.
And now, of course, they're both doing extremely well.
They are both doing well. In fact, when we put out that letter, we wanted to kind of get their permission to be decent about it. And they were totally, they were just totally almost embarrassed with appreciation, saying, oh, I can't believe it. You guys are like telling our story, which we were.
But I mean, that was saving lives. I mean, because both of them were very ill. I mean,
but the sidebar to their story is, it is possible to work with some cases that people think are pretty hopeless. And, you mentioned, persistence, but I've been using the terms patience and persistence can achieve a lot. But there are days where you just think, oh my goodness, is this ever going to show any progress? And, and when some clients are up, other ones take a little nosedive and so on. But it's rewarding work, and I think one of our biggest frustrations is we have a lot of people in Pitkin County and Aspen particularly who want to help, and we've always had a little bit of trouble figuring out how to utilize their willingness to volunteer. So we are going to put out a notice to our folks on our volunteer list about helping with this event that we want to have in September.
Yes, we are. Why don't you tell us a little bit about it? It's Thursday, the 26th of September.
Thursday evening, starting at 5:30 after work for most people. The 26th of September, I am bringing in this fellow named Dr. James Withers, Dr. Jim Withers. He's not unknown in Aspen already, although he's internationally known for his international street medicine symposiums he runs every year. He is famous from a film that Greg Postman made, another Aspen local, about him, and it was titled One Bridge to the Next, and it was in the Aspen Short Fest some years back, not too long ago, but 3 or 4 years ago. And it still tells a great story about the shift in attitude between who are these great unwashed numbers that we don't really want to deal with versus what can we really do to better the situation and find out, they really aren't that different than a lot of us. They have the same sort of sets of needs. Their needs become apparent sort of on the street because of the fact that they don't have the resources. So we're providing some of the resources to help them get started, but with the ultimate goal of trying to help them mainstream and improve their situation.
Right. And Dr. Withers was here a number of years ago when the Given still existed, and we had this great event there. Yeah, I keep
that building
thinking
is
it
gone.
Still exists. I know. It exists in my mind anyway.
It's still there.
Which is, kind of scary. But anyway, we thought to bring him back was such a great idea because we think we've improved our services so much, I think, now with the shelter. I think we're really making an impact. And we also need to raise additional funding to continue these programs, and so...
Well, and one of the things that initiated this was I went to the Healthcare for the Homeless conference in Washington, D.C. in March, and I thought, the plane routes aren't that far off. I'm going to go through Pittsburgh and check in with Dr. Withers, and we ended up one night staying up half the night talking about all the reasons for doing this and the good reasons for doing this and what I call living the spirit of Dr. Schweitzer, which his parents, I believe, were missionary doctors in Africa. So he comes through it, his own family. But we had a really inspiring conversation through half the night till we both just fell asleep. And then the fact that I got to go out on their rounds at night under the bridges and under the viaducts in Pittsburgh, Pennsylvania, where they have a lot of bridges because 2 rivers come together there to form the Ohio. And it was other than it was a freeze my rear end off experience, it was I forgot how cold it could be back east in March, but it was a good experience. I thought, you know, it's been a few years. There's a lot of people in town that never saw that Aspen Short Fest feature, so we think it's going to be a great thing to do. What our plan is to have the film shown, which is only a 35-minute or so film shown in the regular church. You know, people will be sitting in pews,
yeah.
St. Mary's Church, St. Mary Church, and then have Dr. Withers give a public talk, kind of talking about how he's made the choices to go the way he's gone with his medical profession.
Because he went to an excellent medical school.
Oh, he's an Ivy League doctor type guy, but he chose to serve people that were some of the most down and out. So I find that quite interesting because he had those other opportunities, but decided to do this instead. And I know some of our local doctors are kind of inspired by him too, because some of them have participated in this street medicine conference. So we're going to do that, and then we'll have a donors dinner following that.
Yeah, and we have a little board at the Aspen Homeless Shelter, and including Joe High, who's with the hospital, Jane Keener-Quiet with Aspen Community Church, Father Hilton from St. Mary Church, David Siegel, Rabbi Siegel, Helen Clanderud,
John Silich.
John Silich.
Yeah.
And a lot of us have already pledged that we're going to give $500 to the dinner. This is not a fancy dinner, but this is a Cajun dinner by this woman from New Orleans who is, she's a native of New Orleans, and she lives here now and has been doing this as a volunteer with the homeless shelter. And we're going to get to actually experience her food. So it's going to be in the basement of the church, the dinner, and so people can actually see where the winter shelter operates out of and get to know Dr. Withers in a close and personal way after his lecture.
Right.
So we're hoping everybody's going to come. In fact, we've got the involvement this year of the Aspen Board of Realtors, which is extremely exciting, and they're going to help promote the event. And we feel it's so exciting that the realtors who are in the business of finding homes are going to help the homeless population in Aspen, which we deeply appreciate. And the fact that the Board of Realtors will now be featuring a nonprofit every month, and we're going to be the first ones, the Aspen Homeless Shelter, which is
There's
so
a kind
exciting.
of poetic irony to the fact that one of the most high-priced real estate markets in the world is that this group of real estate people are forward-thinking and open-minded enough to say, we really think that this is something we should support.
And so compassionate.
We're delighted.
I think it's wonderful that they've stepped into this and have agreed to really help us out. So if people are interested in attending, we will be taking RSVPs at the offices of the Valley Foundation, Aspen Valley Foundation, at 544-1298.
544-1298.
Is this a
I feel
telephone?
like we're a telephone. But yeah, it is sort of. It is sort of. No, we do want people who are willing to pledge for that dinner or to be willing to come to the public presentation, which is technically free. We're going to ask people to donate to the extent that they can, but we don't want anybody to be turned away from this because it's really a chance to meet Withers, see the film, and get a better perspective on what motivates us to do what we do.
Right.
And
again, I think it's back to that phrase, living the spirit of Albert Schweitzer, which is so beautiful. And I think, sometimes in this community we forget, because of all the affluence and the, wonderful cultural events and art and music and so forth, that we still have a population here of people who are suffering. Not all of them are homeless. Many have mental illness. The Aspen Hope Center is part of the foundation, also is serving that population as well. We have seniors that have many needs. That's another important thing that we feel the foundation is involved in, building the CCRC in Basalt. But again, there is this population of vulnerable people in this community. Not everybody is in that same affluence that everybody expects. And our job, we feel, is to meet the needs of that special population.
I want to thank and acknowledge the Aspen Valley Foundation for their forward-thinking and innovative thought on the ways that they see a need that may not be being met, and innovate and incubate organizations like VIA and Homeless
And
Shelter.
we did with hospice. We actually did
Yeah,
with Right
done
Door.
it
We've
with
done it
many
with a
groups.
lot of groups, Pathfinders, because again, we feel that when there is a need, that we have to be creative and entrepreneurial and make sure that that need is met, rather than being a bureaucracy and having a million meetings and then not having anything happen, you know?
And I think it's important for people in the community to know that that's the motivation, is that we see a need that's not quite getting met, so let's try to meet it.
Exactly.
It's not we're trying to duplicate any services or you know, imply that maybe other services aren't adequate. It's just a matter of like, let's go ahead and fill the need.
Exactly.
And some of them spin off and become long-term things. Others,
Independent
you know,
organizations,
get
right?
gobbled up by another. But it's all okay because that's the way progress is made.
Right.
So what's that? Our work in progress.
That's our work
That
in
is
progress.
our work in progress. Did I get that phrase
Never
right?
ending, yeah.
No, it's good. It's a good thing.
Yeah, but
It's-
again, I think we're proud of the homeless shelter and the accomplishments that you've made. And I know you've got guys now working that,
It's not glitzy. It's not Dennis Basso's runway, you know, but that's okay.
yeah. Well, thank you so much, Vince, for joining us today.
Thank you,
It's been
Chris.
a pleasure to
It's-
talk to you about this important subject. And don't forget the event coming up September 26th, Thursday evening, and call 544-1298 if you want reservations or more information. Again, thanks so much for joining us for our work in progress. We hope to see you next week. Bye-bye.